Welcome back to the Show My Scars podcast. I'm your host, Derek Duker. Today I'm talking with former family nurse practitioner Bree. She is another 417 area resident that responded to a post I made looking for everyday folks willing to share stories of their mental health journey. Bree has an interesting perspective as she has been on both sides of the healthcare fence. She's served patients and she's been one. I wanted to know what she's learned from both experiences. So, without further ado, here's my conversation with Bree. So, you said you were a family medicine nurse practitioner, is that right?
Correct. I graduated from Cox College in 2018, and I worked as a family NP for about 5 years afterwards. I worked here in Springfield and I worked in Washington State in a rural area and loved every second. I could not have chosen a better profession for myself.
Yeah, what type of schooling does that require? What do you study in those classes?
I graduated with my Bachelor's of Science in Nursing in 2015. So I was a registered nurse prior to. And then 2 years after I graduated, I decided, let's do this. And I got my master's. And you can either go the master's route or the doctoral route. I just decided I went in. So went for my master's and took a couple of years. And after that, graduated, took the culmination exam and passed and got licensed and started working.
And what type of responsibilities do nurse practitioners have?
The whole gamut. And it kind of depends on what you feel comfortable and what your collaborating providers also feel comfortable in, not necessarily permitting you to do, but feeling comfortable in your skill set to be able to say, I'm cool with what you just did, because it's on their license too. It's not that way in Washington, so it's a little different, but here in Missouri, because we have collaborating providers, it really is up to what they're comfortable with you doing. But for the most part, I worked in a clinic setting, so you would see anywhere from 18 to 25 patients a day, about 10 to 15 minutes long for a standard visit. See patients from anything from, I've got a kid going in school and they need their school shots and a physical, or I've had people on their last few days who were needing palliative care and someone just to say, hey, let's get this going. So it runs from everything. You see a little bit of everything, and I loved it.
And so you were on that side of things, but also when you reached out to me about coming on the show, you mentioned that you're also dealing with several different conditions yourself. So you have experience on the patient, being the patient as well. And you can share whatever feels comfortable to you, but how do all these conditions intersect and or complicate one another in daily life?
Oh, good grief. So I have epilepsy. I didn't know until a couple of years ago when I had a severe set of seizures that really disturbed my life and took away my career, I think, for a little while, took away my purpose in life, which then complicated underlying mental health issues. And I have treatment-resistant depression. I think you've talked about your struggles with that, and there's, well, I am likely ADHD. Not knowing that your whole life is kind of like waking up to, oh, heck, people aren't like that. Oh, cool. But that kind of intersects with everything that you don't really realize until you're in the smack dab middle of it, that you're like, oh, everything is crappy. It's not just one thing, it's everything. So they all just kind of play off of one another and make each other worse. As a provider, knowing that happens doesn't mean that it makes it any easier to deal with. And I think that's the crap part, is that I've always seen myself as someone who's on the other side, that this happens to other people, that I am somehow above, maybe not necessarily above, but not able to be ill because I treat people with illnesses. That's not the case. It happens to anyone at any time for any reason. Life gets you. And mental health wise, physical health wise, there's always going to be some challenge that will meet someone at some point. And knowing how to deal with that and where to go to deal with that, I think is the challenge. And accepting that help is also a big part of it. Because on the other side, as a clinician, you don't necessarily want to accept the help. And maybe I can share a little bit of this. I am a suicide survivor. I decided to act on the impulses that I'd been having for years and wound up in the hospital involuntarily. And I think it was really at that point when I realized, yeah, this does happen to providers. You can be put in the hospital. You are not going to the ER and saying, oh, no, it's cool. No, I'm a provider. Nah, I'm not. No, what do you mean 72-hour hold? No, it doesn't work like that. And being humbled by that really changed my perspective. So I think maybe that was the point where I said, if I'm going to be here, I might as well do something about it. It's taken a lot of interplay between my physical medicine providers, my neurologist, my epileptologist, my primary care, as well as my mental health providers, my psychiatrist, my psychologist. So it's trying to coordinate your own care. I can't imagine not having the support or the understanding of the healthcare system to be able to navigate that alone. And I don't want anybody else to go through that.
First of all, I'm thankful you're still here, and I'm sure you have others who feel the same way that are in your life. What does recovery mean to you now, and how has your relationship with life changed since that experience?
It's an everyday movement. Medicine was a big point. My psychologist was very open with me and noticing that I wasn't really making a whole lot of progress, even though I'd started medicine. I had been going to therapy for months, and he just kind of pushed me. He said, I'm not seeing you make a whole lot of progress, even though I'm seeing you have a lot of insight. You understand what's going on. There's just stagnation. And I felt that. And he pushed me to seek alternative treatments. And I started to try Spravato or esketamine. And that has been a big life changer to where I can finally start to get up out of bed and wonder, hey, why did I do that? Oh, I actually want to live. Okay, cool. So it's just kind of the little small changes and the energy improvement and being able to take care of my family, being able to do the little things, I think is what it means to be able to be recovered. I think there's always going to be a propensity for me to dip too low. And I think that's why I really have to have that insight to know it's getting too much. It's time to step up the game and ask for some help and not let my pride or my ego get in the way of my own care and being around.
Rewinding a little bit here, what was it like for you to go from being the healthcare provider to being the patient, especially in mental health care?
It was kind of forced on me. Uh, I didn't really engage with healthcare on the patient side a whole lot growing up, or my mom was a nurse. So it was just here, put a Band-Aid on it or take some Tylenol and call it good. So I did my whole life. But then early 2000s, I started having some weird health stuff and went to the doctor and saw a neurologist at the time. And he said, well, you're about 100 pounds overweight and you have anxiety. So go to therapy. So I took that internally to mean you're fat and anxious. There's nothing really wrong with you. Take a pill and go away. And I did. I saw a healthcare provider for migraines, which is what they thought all this stuff was. And he put me on an anti-seizure med, Topamax, which is also used for mood stabilizing purposes as well as for seizures. And I did really well for years. That neurologist that put me on that looked at my previous EEG and said, that looks a little funny, but nothing we're concerned about right now if you're not having seizures. Okay, cool. Years later, I had a kidney stone, came off the med, nothing replaced it. And I started having weird episodes. And I'm like, oh, I'm just anxious. No, I'm just anxious. This isn't what it is. Doctors have always told you that you're just fat, you're just anxious. Okay. And then I realized, yeah, it's a stressful time. I had just graduated from Cox and I just started my first NP job. It was a really stressful environment. There were a lot of changes that were happening in that clinic. So it was very highly stressful. And I started having weird episodes where I would feel rising in my chest. I would start to feel panicky and I would have deja vu and feel really disconnected. And it would last for about a minute and then it would just go away. Okay, it's anxiety, it's a panic attack, whatever. Brushed it off until I moved. Even more stress. Moved to Washington State, had no one out there. It was just me and my partner and nothing else. And wound up having more and more and more of these episodes. It kind of compounded to the point where I was having them at work. And then a clinic nurse said, you need to go see somebody. Okay. I couldn't stop it anymore because work forced me to do it. And they said, yeah, there's something going on. Referred me to a neurologist. And 3 days later, I had a status epilepticus tonic-clonic seizure. I bit both sides of my tongue almost off. My spouse watched me for over 15, 20 minutes. It was nightmarish from what she tells me. After that, I was sent to the hospital by ambulance, my first ambulance ride. Yay. Don't even remember it. Woke up and the ER doctor said you had a seizure. Okay. Now I'm going to have to be forced to deal with the healthcare system on the other side. I had always been kind of, okay, no, anxiety, I can take a pill. I can go to my primary care and get the pill, call it good. Didn't work that way. Now, this was a physical illness that I had to realize, yeah, this is something physically wrong, which pointed me to the direction of, if this is something that is physically wrong, why isn't my depression something that's physically wrong? And I thought that to myself for a while. And I was like, well, maybe they're both not right. I would still go to my physical health appointments for whatever reason, thinking that if I got my seizures under control, maybe that everything else would go away. Didn't work like that. Still hasn't. Still having seizures, but my mood is probably the best it's been. So I think that wishing for one thing and getting another kind of flipped its script on me. My physical health is probably the crappiest it's been, but my mental health is all right. So it's, I don't know, it's a turn. But as a provider going through all of this and being forced into that system and not really wanting to be a part and not ever having been a part except for, here's what I can do for you. Accepting help was so hard. Choosing to take that opportunity was the smartest thing I think I've done.
Did you have a period of overlap where you were both, being a patient and also treating patients? And if so, how did that shape the way you treated your own patients?
Before I really had any type of official diagnosis of epilepsy, when I realized something was going wrong, it put me into a different position at looking at patients. And I don't know if that makes any sense, but knowing that there was something going on with me that no one could see really made me think about the way I approach patients, because they can tell you one thing, but their body is doing another. Their brain is doing another. Their mouth is doing another. You are not going to see their entire life history in 10 minutes. You don't know what's going on. And it really made me think, if that's happening inside me, what's happening with my patients? How can I reach out and get past that? I have 10 minutes with you and I don't know you. How do I get past to reach and do something meaningful? How do I change lives? I don't know if that was something that I may have done had I not have thought, oh, I'm different. Just that realization, I think, made me approach care different.
So you talked a little bit about, you had that 72-hour hold and, the struggles of accepting help. Like what helped you get over that hump and start accepting help and wondering about, how do I get better?
Oddly enough, I worked in mental health for quite a few years. My mom was a mental health nurse for the state of Missouri for 20 years. So I grew up underfoot in mental health. I actually wanted to go into psychiatric nursing, decided not to for whatever reason, but I consciously knew what would happen in a 72-hour hold. I could understand that cognitively, this is being forced on me. This is something I can't get out of. My family said that I'm not capable of making the right choices for myself. And I think that moment when I realized that I'm not special, maybe special isn't the right word, but I'm not unique in my struggle, that regardless of who I am, where I am, what position I'm at, what physical health I have, I'm not unique. That there's someone else out there that is struggling in the same way or has struggled or understands what's going on and has lived through this, that hasn't died, that hasn't let themselves succumb to the negative thoughts, the darkness that is creeping through the back of them all the time. It doesn't have to be so foreboding. And had I known that then, I may have made different choices. But going through that time frame and finally coming to the realization, I'm not unique. I'm not special in this. There are other people in this position, even providers who are in this position, that don't talk about it because they are afraid to say, yes, we're on this side. Yes, we have to deal with these things too. Patients even don't know. Yeah, hey, we're sick too. We're not any different than you. It's just a matter of, okay, yes, I am no different. I do have to accept the help. It would be no different if a doctor had blood pressure issues and needed to take some lisinopril every day. How are we stigmatizing that? We don't. It's something that's physical. Same with the brain. And getting that through my skull into my diseased brain was some effort. And it was really a shift in my perspective. And I really can't quite say what did it. I think it was just a combination of everything, having really good people around me, having a good support system of providers for myself, and really just making the decision to say, I'm going to make the healthiest choices for myself. I'm going to take care of myself like I take care of a pet. And if I can't love myself, I can love a pet.
Talking about that mindset shift and working on your mental health, what have you learned about persistence and self-advocacy when you're needing mental health treatment? And then whenever, because you shared your depression is also treatment resistant, how do you keep going and working when traditional treatments stop working?
From that early point in the early 2000s where the neurologist told me I'm just fat and crazy, I went on a long period of gaslighting myself, where, okay, well, this is just one thing. So you can take the pill, shut up about it, go to therapy. You should be better. The should caught me. So for years, that should stood in the back of my brain like a cactus, just sucking up everything, sucking the life out of me. Finally, when I realized my physical health was something I had to deal with, that I realized that it really was my mental health too. So I think the downward spiral of both kind of led to me accepting help. And maybe in a way, I'm thankful for my seizures. I don't know. But I can say that that's not been an easy struggle, because advocating for myself physically has never been an option. After that point, it was, you're fat and crazy. That's the end of it. That was the point at which, you meet yourself here. No, it really wasn't. I needed to get extra help. But I refused it for years for the simple fact that I felt unheard. I felt unseen. I felt uncared for. And I didn't go back for years. And that's probably why I had the seizure I did, because I refused to get help for many years. After that, though, it really put me in perspective where I thought, I have to advocate for myself now. I have to realize that if I need care, I'm going to have to ask. I think advocating for myself in some context is just allowing myself to be who I am and to have the symptoms I do and to accept them. Not necessarily wish them away, because they don't wish away. You have to address them. And being able to ask for help was a big step. But then even past that, just the asking for help, finding a way to take care of yourself in these contexts, because there's no one in healthcare that really will look out for you the way that you will. I'm sure everyone in healthcare really wants to do well. They mean well, but there is only 10 minutes and an appointment. And if you don't come with a preset notion of here's what we want to do, here's how we, it kind of goes to the wayside. So clear communication, having a mindset of this is where I want to go. Here's my goals. Here's how we can work together to meet them.
Talking about that 10 minutes, that resonates so strongly with me. I feel rushed every time I go into a psychiatric appointment. It's really hard to go in there and remember all the medications that I've been on, remember why I stopped them.
Oh yeah.
If I have any piece of advice for anybody, and I heard this from another guest as well, keeping a journal on what medications you've been on and like how you felt, why you stopped them if you did, and things like that is a piece of advice I could give. But
yeah, I can one up that. One of the things that I've done when I was a young child, maybe not young child, I was 18. My first job was working with a mentally handicapped group home. And one of the things that I remember doing is every day we would track in their, we called it a house book, where all of the important papers were, all of the things about them. Here's where we did all of their meds for forever. It had everything. And I thought to myself, when I was starting to get, to really take action about myself getting better, I thought, if I can take care of other people that way and have all of their things there, wonder how I would do that for myself. So I did. And I got myself a house book that had all of the things about me. Here's all the meds that I took. Here's all of the things that were going on. Here's the providers that I saw. Here's, as much as I could get, I put it all in one place where I felt, okay, if I have to have something happen, if I'm out of it, my spouse can just grab this book and go. But it's also part, okay, now I'm taking care of myself. Now I know all of these things when I forget. If I have to go in to see somebody that doesn't have my records, here you go. It's just a quick down and dirty.
And that brings about a question that I think I sent to you over messages. Being on both sides of the coin here, what are things that you see that could be improved for patients seeking mental health treatment? And on the flip side, what are some things that patients themselves could do differently to receive better care, like we've been talking about?
The quickest thing that you could do, the easiest thing, is to maximize the time you have, because it really is. 10 minutes or less. A lot of times they'll, if you're quote unquote doing well by your scores, PHQ-9, whatever you're doing, ASQ, anything. If your scores are doing well, they generally tend, and this is from myself as well, with somebody, say with a blood pressure, coming back in to check their blood pressure after you started a blood pressure med, their blood pressure is normal. You go in and say, hey, you're doing well. See you later. A lot of psychiatrists will do the same thing. Start you on a medication, have you come back in, check your scores and say, hey, you're doing well. See you later. Instead of engaging with, okay, so what have you done? How do you feel about this medicine? Where are we going to go from here? So keeping the thoughts in mind when you go in to that office, having a predetermined set of how am I going to maximize this visit? How am I going to ask questions that I need asked in a way that gets the answers that I know I need? So I say somebody has an SSRI, generally causes weight gain. So say you have somebody come in that says, hey, I'm doing fantastically happy. We're now in the mild depression, 6 months later, say, but they've gained 30 pounds. They don't address that. And neither does the clinician because they're happy. Where does that go? The patient still feels it, I guarantee you. But the provider doesn't address it because that's not their purview. Making sure that when you go into a provider's office that you have that in mind of, hey, is this normal or can I make this better? And not necessarily relying on the provider to make everything better for you. That's also a trap. Patients will often go in and say, if I just see this one provider this one time and get on this one pill, then I'll be cured. Doesn't work like that. There's going to be, like you said, 10 years or more chronically for the rest of your life. And sadly, our brains are designed to do that sometimes. But going in and working with someone and having that rapport and then making sure that you challenge yourself to reach through and say, you know what, I'm not getting what I need. And also, don't be afraid to switch. If you have a provider that is dead set in the see you later, I'm going to say 5 minutes, go find a provider that's willing to engage with you. Find somebody that's willing to work with you. Sometimes that will work for other people. But you got to find somebody that's going to work with you, not against you or parallel to you, you know?
Yeah, for sure. I'm fortunate enough to have had a couple of pretty good psychiatrists over the years that just to let people know, because we've been hitting them pretty hard here during this interview, but there have been good psychiatrists that I've had.
Oh yeah, there
that
absolutely are.
yeah,
I've
and
got a couple.
yeah, the one that I have right now, she doesn't. I still feel rushed because you know going in there like this is
Yeah.
scheduled for an hour, so I don't have all day here, but when I get back there to her, she does go through several things. They do check my weight, my blood pressure, all those things, and if they see any of those things rising or falling in a bad way, they do address it. And then same thing for therapists. I've had some that don't seem to be hearing what I'm saying,
Mm-hmm.
and luckily the whole time I've kind of been on this like, I'm tired of not seeing progress, so I will switch the second I don't feel heard.
Good.
But
That's important.
yeah, because you don't realize, or I guess the better way to say this is when you first start off, you kind of feel like, or at least I did, I felt like if I switch, like, oh, they're gonna hate me, you know.
Yes.
I,
Yes.
I'm a people pleaser for sure, so
Same.
I I but I read this book called the Courage to be Disliked, and I would recommend that to anybody. These people see hundreds, if not
Mhm.
thousands, of people. Maybe
Yeah.
thousands is stretching it a little bit for therapists, but they're not going to. It might sting them a little bit, but they're gonna have another patient that fills your spot, especially around Springfield. It seems like we are a little bit understaffed around here as far as therapists and
Oh
psychiatrists
yeah.
go. It's gotten
Everyone in the nation, really, I think, is feeling this shortage of staff, and even um, from a primary care standpoint, your primary care providers are on the leading edge of treating mental health conditions, and they're woefully undereducated in mental health, as well as I hate to say it, but a lot of the primary care providers are stuck in that, okay, well, here's your blood pressure's fixed, see you later, done. And that doesn't work in mental health. It's something that you do have to develop that relationship with your patient. So I think engaging in the community, asking other people what have worked for them, specifically within the community, finding providers that are willing to work with your specific mindset. If you're focused on growth and somebody is more focused on a kind of a fixed mindset, won't work out for the two of you. like any relationship, if your friendship isn't working, you can kind of say, hey, we got to adjust or move on. And as a provider, when a patient said, I got to go, cool. I mean, I'm happy to set you up with somebody else who may fit a little better. It's no skin off my teeth. It's totally fine.
Here's the truth. Customers don't remember safe, cookie-cutter marketing. That's why I love Two Oddballs Creative. Their whole thing is helping businesses stand out with epic websites, bold brand design, PR that actually gets talked about, and digital marketing that earns its keep. They'll even help you use AI the right way so you work smarter, not harder. Whether you need a fresh site that converts, a logo and brand that finally feels like you, or someone to run Google Ads and report results clearly, they've done it all, locally and beyond. Grab a free no-pressure proposal today at twooddballs.com, that's the number 2, oddballs.com, or by calling 417-986-6332. Be odd, be seen, or keep blending in. That's your call. Two Oddballs Creative, Springfield, Missouri's creative partner for websites, branding, PR, digital marketing, and AI. Going back to when you first had to stop practicing medicine due to your epilepsy, first of all, like as somebody who has had a career that they greatly cared about and lost it, I know how incredibly hard that is. How did you grieve that loss and then begin to reimagine your purpose?
It was years. I'll say that. I was diagnosed in 2021 after my severe seizure episode. And I tried to continue to work for a while. I had some accommodations to where I would work a little fewer hours. Didn't work out. I ended up getting hospitalized for about a week for inpatient monitoring. And I was my contract was set to expire while I was in the hospital, and they sent me a notice of contract termination while I was in the hospital in a state across the country from the Midwest where I'm from. So everything just kind of compiled to be kind of crap. And it took away that it wasn't necessarily prestige, but the title and the air that you can kind of carry. And losing that set of, I feel, a kinship to being an outsider, that switch has been unreal. Coping with that has been an everyday process. Waking up and knowing that, I'm not going to a job. I'm not seeing my patients. I lost all of my patients. It just, you lose a family on top of losing your career. I'm still planning on doing something. I'm still planning on working at some point when my seizures are under more control. But it took me getting hospitalized, feeling hopeless, worthless, lost, without a label, and finally meeting myself at the bottom, and realizing that, yeah, I'm still a person underneath that, regardless of being a clinician, regardless of being a daughter, of a spouse, of a friend. I'm still somebody, and that somebody still has worth. So maybe I should start treating myself that way. And that was the point at which I started, okay, well, I'll do that. I was very lucky to accept that on my internal compass. and listen to the good voice instead of the cactus. But yeah, switching and being, it's just every day to realize, I'm not waking up and doing a job. I'm waking up to be me. And maybe that's just as important. So I've tried to modify things. I call myself a freelance joy spreader. Whatever I can do to make other people happy in that day, that's what I'm going to do. If it's just smiling at somebody on the street, if it's petting a dog and making myself happy, if it's going outside and touching grass, it's just something that I want to make other people happy. And that's really my job. My job is not to be a nurse practitioner or a nurse or anything else. It's just to be happy with others and to spread love. So that's what I decided to do.
Yeah, I love that. When you sent me that message, it made me smile. That kind of I love that. If you could speak directly to a nurse, doctor, or therapist that's listening right now who feels like they're falling apart inside, what would you tell them?
Listen to yourself. That little voice that's inside you telling you that something's wrong, listen, hear it. Don't shrug it away. Don't try to say that it doesn't exist or say that it's insignificant to the face of everything else that you're doing. Being a parent, being a nurse, being a caretaker, whatever it is, that still little voice that's inside you that said there's something wrong, listen. Just listen. You don't have to do anything about it right now. Just the knowledge that there is something wrong gives you the drive to make a change. Just roll with it. Let's figure out what I can do to make this better. But just acknowledge the fact that there is something wrong and that there's something that you can do to take care of yourself. Because there absolutely is in every situation. Absolutely. Don't ever have that thought there is nothing you can do, because there is.
Yeah, I think caretakers at any level,
Yeah.
they have to remember you can't take care of someone else if you are not taking care of yourself. It's too difficult.
There's a couple of things that I've always said: physician, heal thyself, and you can't pour from an empty cup. And that's the truth of it. If you are falling apart every single day, the world is going to fall apart with you. So feeding yourself, making sure that you're in a good emotional spot, that you're in a good physical spot to take care of others, that makes a big difference. That is the ultimate work. But it is something that will make life more bearable and more tolerable, and you might enjoy it.
Yeah, what does a good day look like for you? And you've touched on a couple, but I want to reiterate this point. But what tools or supports help you through the harder days?
Spravato was probably the biggest thing. That was the tool that got me to the point where I'm not listening to that desert cactus. And having that distance, walking further from it, is key. So I think medicine is one part of this, but then you've got to work with it. So on top of working with the medicine, there's making sure that you're taking a shower, you're brushing your teeth, you're going to the bathroom, you're eating well. um, the basic things, because a lot of people will get lost in this. Well, I have to do the lofty thing. I have to make sure that the laundry is done and the house is clean. And no, start small. Whatever it is, if it's just, I will get out of bed to go to the bathroom, perfect. Start there. That's all that matters. At that point, think about it. Okay, well, I got up. What's next? Look towards something else. The fixed mindset of I'm stuck here can really catch you. And count the small things. Remember that brushing your teeth is a positive thing. You may not have brushed your teeth for a week, and brushing your teeth today is a freaking win. That's amazing. Give yourself the credit for that. The small things, even if it's just, I brushed my hair, amazing. Count yourself those wins, because they don't come often. And when they do, really learn to lean into them, because they give you a sense of joy. When your kid comes up to you and says, I love you, that's amazing. Like, you have another little thing that tells you that you're worth something. That's incredible. Like, that's the little wins, those everyday little things. And I may never get to return to a career, but those everyday little things make life worth it. But then there's also, making sure that you're journaling, you're feeding your brain. Get out of the brain rot, get off of social media. Comparison is the thief of joy. Stay away from negativity as much as you can. Find your people, get out there in the community and actually do things. Go on walks, get out in nature. Just stay away from, and it's easy to say stay away. It's really hard in practice. But if you can kind of put things in perspective for yourself that, today, good things are going to happen regardless of the bad things that happen. So look for the good. Find something that's going to be okay. There will be something. I promise.
Yeah, one of the sayings I like a lot is you'll find what you're looking for. And
yeah,
so that's why gratitude works. And I know I have a hard time doing gratitude journals, but you really, once you get into it a little bit, and there's other ways you can do this. I liked what you said about leaning into the good things. Like when, my daughter says that she loves me or sends me something, we write each other notes and leave them for the other one to find a lot. And I keep them and set them up in different spots to remind myself, because when I see those and then you get that little feeling inside, and meditation's been a huge thing for me and mindfulness. And then I just like kind of close my eyes and just like really feel what that feels like inside. That helps so much. And then it's easier to find the next good thing. And so, yeah, I really like that advice you give. And yeah, starting off small and just getting the ball rolling. I was a huge, eat the frog early in the day kind of person, tackling the hardest challenge first off in the day. But I've started to try to, on days that I can, exercise earlier in the day, or do some form of self-care. And then when I'm done with that, really give myself props, because it was really easy early on where I would, somebody gave me that advice and, I would do it and just to get it done. And instead now when I'm done with it, I kind of sit there for a little bit and like, hey, you used not to exercise near as much. And even if I'm not doing it every day, on the days that I do, I'm like, hey, you didn't do this yesterday. And you did it today. So congratulations. And just, remembering that and really being mindful and letting it sink in is a huge thing, because it's so easy to let those things go by and not pay attention to them.
Yeah. If you don't know what you're looking for, it's hard to find it too. So putting yourself in that space of good things do happen. It's just that they're hard to see sometimes, but they're there. They're always going to be there. It's just where you look. There will be something that you'll find that will make a difference. For me, volunteering. I volunteer at the Glow Center, and that makes a big difference. Just to be able to see other people that, are accepting of themselves and who they are, and looking for someone else who does. To be able to feel a kinship, to know that there are other people like them out there. So I volunteer as much as I can. I have my pets, my cats. They really make a big difference as to, well, I got to feed something else. Okay. So it's just the little things, I think. Even if it's not going out and saying, I'm going to change the world, maybe one day you will.
Is there anything that I haven't asked that you think is important to share?
I think one of the things that I probably didn't touch on as much has been communication with providers. So one of the things that I think has changed how I interact is speaking with my provider is, I'm here because, and filling that in and saying, I'm here because, say, my medication isn't working, or I'm here because I've noticed this. And then following that up with, I need you to, whatever it is. If it's, I need you to adjust the medication. I need you to refer me to a psychologist. I need you to discuss alternative treatments. That's part of it. Following that up with, I will or won't consent to. So making sure that you mention with your provider what your boundaries are. I will not consent to surgery. I will not consent to X. But I will consider options like TMS or making sure that you let your provider know what options you're considering, what options are on the table. That way you can come together and say, okay, if this is where we're headed, let's go this direction. That way they can steer the conversation to something that will fit you instead of you leaving the office thinking, I didn't do anything. They walked in, I don't remember anything that was said or done. So kind of coming into your provider's office with the, I'm here because I need you to, I will or I won't consent to. That way they have the full spectrum of things.
I really like that, actually. Because sometimes, I'm like, oh, it's, today's when I'm going to my psychiatric appointment, and then I just wander in there, and
Yep.
I really don't, I don't know that. And that's not all the time. I definitely being on medication as long as I have that, it hasn't been helping. I definitely have a goal of finding what does help. But yeah, it's so stressful that sometimes I'm like, I'm just holding on until this is over.
Yep.
And I don't know where that comes from, because I don't know that I've had a provider that's been mean to me or, but for some reason,
you can go in not thinking anything negatively about the clinic or the provider or anything and still have that air of, there's something going on that I don't know about. And it just puts you in that I'm a child type of setting, and your fight or flight just done. I'm on, and nothing is remembered.
Yeah.
So going in with your clear, even if you have to write it down on a piece of paper, just I'm here because I need you to, I will or won't consent to.
What misconceptions do you see most often when it comes to psychiatric medication, whether it be in the medical field or among patients?
That it's a cure-all. That you take the med and it's done. Even providers. We've done a lot more research since I've been a kid. When we threw antipsychotics at everyone, basically, and said, here you go, here's some Haldol. We realized that caused problems. So things have been changing slowly over time, but we're doing a lot more research to show that, yeah, maybe the serotonin theory is not right. Maybe what we're doing is not addressing anything physically. What are we doing here? So a lot of providers aren't keeping up with that research. They're continuing to just say, I'll throw some Lexapro at it and call it a day, just the same as we did Haldol back in the day. That causes downline problems, and they're not screening for those downline problems. And patients will even go in thinking, I have ADHD. If I just start Ritalin, then my entire life will be different. Not necessarily. You can start a medication that will get you closer, but you still have to take that initiative to go, you know what? I need some extra boost. I need to work with myself too. But yeah, medicine is not a cure-all. Even if you don't try medication, there's a ton of other options out there too. There's even above therapy, there's mindfulness, meditation, group therapies. So I think it's a matter of everyone needs to kind of take a pause and realize that things that we think specifically are for mental health aren't necessarily, and things that we don't realize that are for our mental health really are. So maybe changing the script and going in, realizing that it's not going to fix everything, but it'll get me one step closer to where I need to be. It'll get me out of bed to where I can go to the bathroom and brush my teeth. If it doesn't, there's always something else. You are never at the end of your rope. There is always somebody, something that is going to make a difference for you, even if it's just going into Walmart and thinking, well, today sucks, and the greeter smiles at you. That's your win. This is kind of silly, but I just recently read Matthew McConaughey's book, Green Lights, and that's your green light. That's what you're looking for to realize I'm on the right path, doing the right things. I just need to look for those little instances that remind me, but never give up, because those little things are always there. You turn a corner and one of them's going to be there. So just give yourself the grace to realize it's going to be a minute, but I can hang on.
Yeah, I'm well into the double digits on medications that I've tried. And I do want to encourage others that by saying like it is right now, it's not near as bad as it used to be. And
No.
that's
Oh
without
no.
medication.
Yeah.
Depression, well, mental health in general is a whole body issue.
Mhm.
That you can help with exercise or like the many different things
Yeah.
you listed off,
Oh
mindfulness,
yeah.
meditation, yoga, social stuff.
Yeah.
I've started reaching out to people a lot more, and not to just say, hey, I'm depressed. I'm not just sending, texts like that. A lot of the times it is, I will reach out and give them what I want. Like
Mhm.
I will reach out to my buddies and tell them, hey, man, like I love you. I hope you're having a great day, or just send something to try to make them laugh. and
Yes.
yeah, looking for the little thing. I love that you said the Walmart greeter because someone popped
Yeah.
up right in my head. I used to live in the city limits of Springfield, and I went to this one Walmart. And if anybody in Springfield's hearing this, they might know which Walmart this is because this greeter has to be famous because he is very loud about welcoming people to the store. And when it gets busy, you will hear him across the store. You have a good day. You have a good day. And I can't tell if he's being facetious or not. It can't be because he did this for years.
Yeah.
And I waited for him to give up, and he never did. Some people wouldn't like even look at him. I hate that for those
Oh.
greeters. I used to work in retail and be near the door, and I know what it feels like for people to constantly just not look at you, or like if you welcome them, they look at you like you're insane. I'm like, no, we're supposed to be social here. I'm trying to like Walmart sucks to be in. Like
Yeah.
um, but I stopped and told him one day, I was like, you are my favorite Walmart employee I've ever met. I mean, and he just smiled real big and you have a good day. and, but that was one of my little things. Like when I would go to that Walmart, I'm like, well, at least I'm going to see him and he's going to make me laugh when I come in by just how grandiose he was about welcoming people to the store and wishing them a good day on the way out.
And you never know how that affects someone else. I didn't really realize that until I was in healthcare, I think, that the tiniest little thing ripples to mean so much for someone else. I had a patient I thought I did something relatively simple for. I mean, it wasn't anything big to me. It was just a quick thing in and out for me. But what, 3 months later, the patient came by and brought a hand embroidered little plaque that I have sitting actually right in front of me, signed and everything, and just said, "You made the biggest difference." I didn't realize it, but it made the biggest difference to that patient. And I thought, that's what I want to do. It's not that I really need all this grandiose knowledge to say, this is a medication that's going to work, or we found that you have this. And no, I want to make a difference to where a patient goes home and thinks, I'm special. I was seen. Somebody thought about me. That's what I want. That's what I want in all of life. There's really not anything that we can't do together as humans. As divisive as things are, we all are in this together. We're all just walking each other home. So making that easier and making it more tolerable for all of us, that's the goal. It's not to sides or labels. Doesn't matter. That is all fluff. It doesn't mean anything because when it comes down to it, we're all living inside these bodies. We're all meat suits and we're all just walking each other home.
I don't think that, if anybody listens to all my episodes, they're going to get sick and tired of hearing me say this, but to make that difference in someone else's life, and you don't have to, volunteer someplace or do something
Mm-hmm.
big. Like you mentioned earlier, just smiling at people on the street. My mom said the other day, we live on this little back road, and we were driving down the road, and she's country, and so we used to know everybody on this street, so we're just so used to, I do it still too,
The wave.
wave at everybody. And the other day my mom was like, nobody waves at each other on this street anymore. And I'm like, no, they don't. I've also noticed this, and I know it's weird because you don't know the other person in the car, but just to, in my mind, I'm like, oh, they got over for me a little bit because it's,
Yeah.
not not a traditional wide street. And so we're like two tires in the ditch sometimes as we pass. And, it's just such a small thing that you can do. And, it doesn't make the biggest difference in my life when someone does wave, but I notice it.
Mhm.
And just that little act of kindness, the more that you experience that throughout the day, that makes a difference to yourself and to others. And it
Yeah.
fills your own cup up when you do something like that for someone else. I'm old school. I hold the door open, for the
Mhm.
person behind me. And when they say thank you, it perks me up a little bit. I've had little old ladies like, people don't do that as much anymore. And I love it. It's kind of selfish of me, I guess, hearing me say this stuff out loud, but it does make a huge difference to others and to yourself when you're just kind.
Yeah. That little old lady that you opened the door for is thinking the world is still good. There's still good people that still want to be kind. And it doesn't even have to be opening the door. That's just a gesture. It's just even just saying, "Hi, how are you?"
Mhm.
Or even just, acknowledging that they exist. Because that sometimes when you're struggling so hard with yourself to not exist, being seen by someone else existing makes a difference. Even if it's the smallest thing, having an interaction, heck, you go into the gas station and somebody opens the door for you. You think, okay, maybe I can give it another 10 minutes. As long as we keep doing things that are kind, we can still exist. I think as people, as a country, as a world, we can't lose sight of the small things. Because yeah, we can wish for peace. We can realize that genocide is terrible and the world is, there are a lot of complexities. But underneath it all, if we remember that we just want to be kind and be kind to others, that's where it all comes from. And then you can start making those little decisions to, okay, I'm going to make the decision to treat others with respect. So remember that people are people, flawed and all. But yeah, it's that being there for others and seeing other people, even in the small moments. It carries you through. It reminds you that the entire world is not dark. So people keep doing them. Please keep
Yes.
making those little gestures. Even coming back and saying 10 years later, I really appreciated the friendship that we had. Oh my gosh. Can you imagine somebody coming back and saying that to you? As a person, I would be incredibly embarrassed to go back to somebody that I haven't talked to in 10 years and say, I really appreciated it. But think on the other side, that person that's getting that message from you is feeling so incredibly warm. So just remember those little things. It's not all about how you feel. Remember that doing that for somebody else makes you also then feel that warmth. Be daring. Lean into doing something that might feel a little scary. Once you get past that little fear point of engaging with someone else and getting past your barrier, sometimes good things happen. Sometimes they don't. Sometimes they do. And the good will outweigh the bad eventually.
Well, thank you so much again for coming on and sharing your unique perspective. And I had the fortune of having what was it, K through 5, I think. My elementary school principal would be the easier way to say that. Every morning he had us read the golden rule on the wall. He had this huge poster, do unto others as you would unto you.
Mhm.
Um, and that made such a huge difference, as I got older. As a kid, I was like, oh my gosh, we have to do this every single day. But I remember that,
Yeah. See,
to this
you
day.
remember it though.
And I really think that is a huge thing for us to end on, especially these days, as you mentioned, all the crazy things that are going on. So I really appreciate you bringing that up, and
Yeah.
for everything else that you shared with us today.
It's not hopeless, guys. It's not hopeless.
It's really not. It's easy to fall into that trap, but it is, there is a brighter day tomorrow.
Yeah.
So
Even if you're struggling with all sorts of crap, always a day tomorrow.
yeah, for sure.